It's important for the administration. It's certainly important for Secretary Kennedy that we work together, that there are no silos or walls between us. This is how public health should work. This is how it is working, and I think this is a perfect example of how we are coordinating, how we are speaking, how we are interfacing, and doing things together for the good of the nation, certainly the good of the people of Nebraska, and the good of the individuals who've been repatriated here.
And then the patients in Atlanta, are they quarantining there as well? Is there a reason other than space as to why they're there? Any explanation as to the separation?
Nothing more to add. There would be evaluation of symptoms there, and then next steps would be similar to what happens here.
And they're quarantining as well?
They're under medical evaluation right now. Similar.
Hi, Kaylee Schuyler with Fox News. I'm back here. If one of the patients who's currently located here in Nebraska were to test positive, would they remain here? And is it always a 6-ish week quarantine, or can it vary?
Sorry, go ahead. Sorry.
I was just going to, I'll start off by saying that is why we've maintained space in the biocontainment unit in event that becomes necessary. How a lot would depend upon if that was the only individual or if there were multiple individuals. That would get us to capacity of the BCU, and if that occurred, we would work with our federal partners very closely and make sure that they were transported to another facility that had the capability.
Sorry, I was just going to add on the 42-day monitoring period. The reason for that is that's the maximum incubation period that's been seen for the Andes virus. So the incubation period is the time from when someone was exposed to when they develop symptoms. That's really at the very, very long end. Most people who end up infected with this virus will develop symptoms much sooner than that. So that's a conservative time frame, and that's the number we're using. I'll note this is a much longer incubation period than we see for a lot of other viruses, but typical for hantaviruses.
Ian Lee with CBS News. You mentioned this incubation period being so long. We know that there are some Americans who already traveled back to the United States. They're in their communities. How can you guarantee that they don't have the virus? And can you guarantee that when people leave here that they will not be carrying the virus?
Would you like me to take that question? Certainly. There's been contact made with all of those passengers who returned. The state health departments have been monitoring them on a daily basis, including symptoms and temperature checks. They have plans in place to make sure that they can isolate effectively in their homes should they develop symptoms. If they are developing symptoms, they have ways to get tested safely and to make sure that they're not going to spread it to others. Again, based on what we know about this virus, and this, again, I want to emphasize, this is not a brand new virus. This is a virus, even though it's new to many of us, it is a virus that has been known for decades now, and there's been outbreaks that have been dealt with in other countries, and even here in the United States. This is not the first time we've had Andes virus in the United States before. The data that we have now all suggests that transmission, that spread between people, happens when people are symptomatic. And so I think that gives us, when they have symptoms, and so that gives us one layer of added protection to know when the risk is going to be greatest and how we can best protect the health and safety of the passenger and the American public.
Can you give us more details about those other Americans? What kind of procedures are they undergoing? Are they in quarantine as well? What medical treatment are they receiving?
So they're not receiving medical treatment when they are not symptomatic, and it would only be for evaluation or testing, or if their symptoms progressed, then they were required if it would turn out to be positive, or they needed care for something else. They're following the recommendations that we have in our overall guidance for this daily monitoring and contingency planning.
And when it comes to testing, there was one person who's asymptomatic and they tested positive. With this testing, can you test everyone and just see if they have the virus? And this person who has symptoms, have they been tested? Are they confirmed positive with the virus?
So when it comes to testing, I actually will defer to my colleagues at University of Nebraska to discuss their plans on testing. The traditional way of managing hantavirus testing has been that you really focus on testing people who are symptomatic or having symptoms. That's the current stance right now, but clearly we're going to keep reevaluating this as we learn more about this virus. And I'll turn it over to my colleague here.
I mean, we're in the process of evaluating all of the individuals, and as was mentioned, we're giving them a little bit of a rest period now, just given their ordeal. And then we are going to go back and jointly with our federal partners ask questions about their exposure and get a lot more information from that individual. And then we will make individualized decisions on testing based on those conversations. The individual in the biocontainment unit will be tested, and that's only because that individual did have this kind of equivocal positive test previously, not in the United States. And so we will be testing that individual, but the individuals in the quarantine unit, that will be a conversation and a lot of conversations between us and those individuals that are in the unit now.
Yeah, and just to add to that, in partnership with the Nebraska Public Health Lab and the university, we've developed and validated the necessary testing so that can all be done here and done quickly. And it's a PCR test.
If I can follow on what you were just saying about the individual in the biocontainment unit, has that person developed or shown any symptoms since they've been here? And do we know if there is any evidence that this could be transmitted by someone who is asymptomatic? I know that's not typically what happens, but is there evidence that that could happen?